Hi, good morning. My name is Mary Brady. I'm with the Food and Drug Administration, and I don't work in the drug area. I work in the device area, so don't ask me any questions about drugs today, please. But I do have a question for you, James. Thank you for your testimony. It always hits home when you can hear somebody talking about how something has worked so well. My question for you, though, is did you use any type of equipment, and how well were you taught to use that equipment? How comfortable did you feel in your environment with that equipment, if indeed you did use some? Thank you.
Well, with my mom, I had, they connected a PIC line to her that I had to clean and change and administer the medicines for her. And they gave me very good training. I knew how to do it right at the moment they were showing me. They let me do it. And I watched them do it one time before, and then they had me do it. So my mom wasn't afraid of me doing all that for her. With my dad, he had a nebulizer. He had, like I said, all the cocktails. That was the only, he had air. Everything was fine. They came out, they showed me how to do everything. I didn't have any problems at all with any of the stuff that they brought out. They came and brought the bed, they brought the wheelchair, they brought everything. They hooked me up with paratransit so that I could get him to, his most important thing that he liked to do every day was go to the senior center. And I couldn't take him in there because I couldn't get him in the car and I couldn't move him up and down the stairs and everything. So that helped out a lot too. And he was able to go one time before he passed away. He got very sick after that. And so they help a lot. It was a very, very good experience. I didn't have any problems at all with none of the equipment. They taught me very well exactly what to do, and they explained it in a way where there was no questions, really. And if I did, and I don't think I did, I would just call them and they would let me know.
James, Mr. Martinez, a question. So you talked about, it sounded like you were talking about moving between home health care and then there was a switch to hospice.
Mm-hmm. It went to AIM, and then with AIM, it was like the illness management. They came out, they set up all his medications for me, night, day, afternoon, after dinner. They wrote they gave me a piece of paper that had everything written on it and a little plastic thing that they put on the refrigerator so that I could know exactly when his pills were, and anybody else that would come in could also do that. And then every bit of information that they gave me went on the refrigerator, so we had to take pictures down and stuff. But we put it all up there so that it was a lot easier for me and for if my sister came over or somebody else to see what to do and numbers to call.
But it sounds like that transition, that change went pretty smoothly for you.
It did, because we came home with my mom on Sutter, and I chose it because I had heard a lot of good things about it, and they had a ton of different home health care people. And so I chose Sutter, and that was the best thing I ever did because I got so much. Even right now, before I left, they're having a remembrance for all the people that have passed, and so I was invited to that workshop also. I'm sorry, I'm kind of nervous. What was how did you address that?
You answered it. You did
Okay.
You did great.
I'm
You did
sorry.
great. Did great.
Hi, Terry O'Malley, Partners Healthcare in Boston. Mr. Martinez, a remarkable story, and your parents were very fortunate.
Well, thank you very much. Yeah, they taught me well.
So I have two questions for you. One, if you were to redesign or change the things that happened to you, were there things that you were missing that you wanted, that you needed, that would have been more helpful? Can you think of anything else that you would like changed and how that whole process played out?
Well, the fact that because my dad was retired for so long and he had made too much money with Social Security and his pensions and things that we were not able to get any kind of health care for him. That was one thing.
So healthcare for
As you know, like in the support services. And until we got Sutter, I was at a loss, to be honest with you. I went down to it's called In-Home Support Services. I went there, tried to hook it up. I signed a million papers. And afterwards, they denied me because my dad made too much money. Or this was another thing, that they would give me the the money to come and take care of him, but they would take it out of his estate when he passed away. So I think something like that, if anything like that could change to where, it'd be a little bit more helpful to the family. I mean, that's a lot of money. I'm paying over $1 million right now trying to, and I don't think I'll ever finish paying it, but I got to give them something.
Thank you. And the second part of the question is sort of who was there to take care of you? Because it sounds like you were a 24-hour job for a few years.
Sutter.
Sutter.
Yeah, they did. They took care of me. They came with a social worker and a nurse. Nurse would take care of my dad and do his vitals and all that and talk with him. And then the social worker would come into the kitchen with me, and then we'd sit and talk about me. How can I take care of myself? What do I need? And they offered me a lot of support on that too, because they said if I couldn't be healthy, I couldn't take care of him. So I had to try and stay as healthy as I could.
Great. Thank you.
You're welcome.
Mr. Martinez, thank you for bringing us to the essence of this and speaking from the heart. I think that oftentimes we get really caught up in things that remove us from the heart. Mr. O'Malley, actually, his second question was the one I wanted to ask, because family caregivers tend to burn out very easily.
Yeah, I
But
did.
you seem to find a way to be resilient. I hear you speaking of the care for your parents with joy, and not everybody finds that joy. So tell us a little bit about where you found that source for you as a family caregiver.
Found the strength to continue. Well, it all goes back to my parents. My mom, she taught me everything I know, and one of the most important things was to always, be nice and take care of people and, open the door, do all the stuff that, everybody's parents tell them to do. My mom was a very special lady. Her mother died when she was 11, and so she had to take care of, 8 other siblings, and along with her brothers too. So she instilled in me a lot of strength. And so no matter how hard it got for me, I prayed. And I went to church and I talked and I was telling God the things that I'm telling myself, but I'm saying it in a environment that, kind of let me cry and then go home and continue on. And I think my religion, my mom, my dad, of course, was the one that gave me the strength. And then when I would break down, it was always Sutter that would come and invite me into a workshop for bereavement and help me to get over the little things, to cry. That was the most important thing. When my mom died, I never really vented any of that out. And so I got very angry, and I wanted to choke everybody that I saw, everybody that talked to me different or talked to me without any kind of respect. I felt like, I was being, I knew I was sick. And so who did I go to? I went to Sutter and I told them that what was going on, and they helped me all through that. It was a wonderful experience, really. I don't want to probably ever do it again. It's my mom and dad. If one of my sister, my daughter, or my son, or something like that, I would probably do it again because that's just my nature. And I think it's easier now that I know, and that's why I came out here, because, with everything that they did for me, the healthcare, this is the least I could do is explain what happened to me. I'm not the only one. There's a lot of people. There's a neighbor down the street that he's not on Sutter. His dad wasn't on Sutter, but he passed away and he took care of him. So the two of us would talk and kind of get a little bit of strength from each other. So we had I had a lot of support from a lot of different places, yeah.
Thanks for helping us reconnect with the meaning of what we do and helping us set the tone for this 2 days. Thanks very much.
My pleasure.
Dr. Eads?
Good morning. I'm Tom Eads from Department of Veterans Affairs. Mr. Martinez, thank you very much for making this long journey and sharing your personal story with us. I have a question about trust. You were, and sort of when that happened, you were at home with your mom and she's ill, and many times, I'm sure, things changed in her health that probably made you quite uncomfortable. And I'm wondering, you know, at that point you had a chance, you could call for emergency help, an ambulance, or take her to the emergency room, or you could call Sutter. And I'm wondering, at what point did you get comfortable enough and confident enough that you trusted this home health system, the healthcare system, enough that you were comfortable with that and made a call to them rather than for emergency help?
Well, with my mom, it was when she got sick, they wanted to send her home hospice after they diagnosed her with cancer. So at that point, she wanted to stay in the hospital because she didn't want to, you know, burden us with the problems and everything. She thought hospital was the best way. But I told my mom that I couldn't take care of her at the hospital. You know, that was what I wanted to do, was make my mom well. And I couldn't do it just going and visiting her every day, staying there all day long and washing her up and, you know, feeding her and doing all that kind of stuff. I told them, show me how to do the stuff that she needs at home and I'll take her home and do it. So they asked who did I want to go, and they gave me a list like this, and it had Alliance in the beginning and all the way, you know, and I chose Sutter because I had heard from other people that had similar experiences that they were very, very good. So we called them, they came to the house, and in those few months before my mom passed, they're the ones that made me want to go back. When my dad got sick, they asked me who did I want to come home with him, you know, what health care, and I said Sutter. So they looked through and they said, well, we don't do Sutter at the hospital that we were going to. They have these other ones. So I said I wanted Sutter anyway. So I called the 800 number, and I called them, and they came out, and they released my dad from the hospital, and he came home. I was very comfortable from the very beginning with them.
Thank you.
You're welcome.
Good morning, Mr. Martinez. I'm Marguerite Lapson with the Joint Commission. I was interested to hear from you if you could compare for us the education that you got from the hospital staff as they were preparing you to go home against the education and training that you got from Sutter when you got home. Was it the same, similar? How was it different? And how to take care of your mom?
It was way better with the home care people because I would go to the hospital every day. And there were times when I'd go in at 9 o'clock and my mom hadn't been cleaned or dressed or fed. And when I would go up to the head nurse, the charge nurse, and tell her what's going on, oh, well, the lady comes in the morning and she starts on this end of the hall and changes beds and goes all the way around. I said, well, tomorrow, do you think you can go on that side of the hall and work around the other way? And so, you know, I was always at odds with the hospital. I could not get good enough care for her. My dad had, you know, IVs, and he had medicine going in his arms, and he got up in the middle of the night to go to the bathroom, and he had a catheter on, and he didn't know. And so he got out of bed, and he fell. He didn't get picked up for hours. This was in the evening. When I got there in the morning, I had found out there was an incident report that he had fallen. He was fine, they said, but I went up and I wrote a formal complaint that there was nobody on staff, got names and everything of everybody. I wanted him out of the hospital. I don't think they give good care there because they know he's dying and they don't want to do nothing about it. There's nothing they can do, they say. Well, there was something to do. They called Sutter and they came and they helped me. And he lived for 2 more years. So that was great. I wish my mom could have stayed alive a little bit longer, but, you know, she was sicker than my dad. Thank you.
Well, Mr. Martinez, on behalf of everyone, I really want to thank you for sharing your story. I think it really, really helped set the tone for the next 2 days, and I think it will help hold our feet to the fire in terms of really trying to think thoughtfully about the issues and come up with future directions. So thank you so much for your time and
You're very
all of your work.
welcome.
Thank you.
Thank you. Thank you all.
So next up, we have Dr. Bob Rosati, and Bob is the Vice President of Clinical Informatics at Centerlight Health System. He's also on faculty at the Weill Cornell Medical Center and Hofstra University, and Bob is going to talk to us about the current state of home health care. So it's wherever you want.